I'm going to go to the next topic, specifically, again, about ICU capacity, but also specifically ECMO management. So we have Dr. Nicolas Nessler. I'll hand it over to you, Dr. Nicolas.
Hi, everyone. My name is Nicolas Nessler. I am an intensivist and anesthesiologist. I work in a cardiothoracic ICU in the University Hospital of Rennes. So let's talk about non-COVID ICU. In my hospital, the cardiothoracic ICU is in a separate building than the ER and the surgical and medical ICUs. That's why we decided to keep it as a non-COVID ICU. The usual bed capacity is 17 beds and in my ICU, and 7 new beds were created in the PACU, as you can see on the picture. The ventilation capacity has been increased with anesthesia ventilator. So I want to remind you some basic rules which need to be followed with the anesthesia ventilator. It's not so simple. You need to use high fresh gas flows to prevent humidity from accumulating in the circuit. So fresh gas flow has to be 1.5 times the minute ventilation. Of course, as with a critical care ventilator, you need an HME filters to maintain an adequate humidity in the lungs. Startup tests need to be performed every 72 hours. And you have to keep in mind that the patient cannot be ventilated with an anesthesia machine during the startup test. So it can be a major limitation, a major issue for the most severe patient, for RDS patient. So you have to think about it before to put the patient under the ventilator. In my hospital, usually we don't sedate patient with inhaled anesthetics during long-term care. So the vaporizer have been removed, as you can see in the picture. Okay, so that's basic rules you have to keep in mind. What about the staff? The nurse staff has been increased by mixing ICU nurses and anesthesia nurses, so they can share their experience, and it is especially useful for managing the anesthesia ventilator. Concerning the OR, we have maintained only the emergency in cardiac surgery, so aortic dissection, endocarditis, or emergency CABG. And we have also limited the cardiac transplantation program and the long-term mechanical circulatory support program during this period. We can talk now about the ECMO. Next slide, please. So as you know, ECMO is a rescue therapy for, and it concerns only a minority of patients, more severe patients. I can see 2 different types of COVID-19 patients who may benefit of the ECMO support. First, severe RDS patient related to viral pneumonia or to ventilator-associated pneumonia. The second category of patient I can see who can benefit from ECMO is a cardiac failure patient, and 2 main possible causes are myocarditis, which have been described in COVID-19, and pulmonary embolism, which might be very frequent according to the early reports. For the ECMO, one of the big issues is the limited resources, and such as ECMO console or tubing. So you should consider a centralized regulation. And for example, in our area, we have a regional centralization with everyday meeting. And for all these reasons, for example, we made the choice to limit the ECPR program, and it's only now a case-by-case decision. ECMO patients must ideally be managed in high volume expert center with more than 20 cases per year. And of course, in this context, the indication must be carefully evaluated. And we can suggest the EOLIA trial criteria for RDS patients. You know, so this paper was published last year. And no, in 2018. And ECMO support should be offered only to patients with a good prognosis with the use of ECMO, and especially in the context of possible shortage of resources. For example, if you have the combination of advanced age, comorbidities, and multi-organ failure, it's probably not a good indication. Finally, at this stage, we don't know really if ECMO support is a good therapy in COVID-19 patients, and we need to improve our knowledge on this therapy. That's why we designed a nationwide study that involves more than 35 centers in France to best characterize which patients have been offered such a therapy so far, and which patients will benefit the most of the technique in terms of outcomes. The study just starts. So far, we know that more than 200 ECMOs have been used in France, but I have no more specific data to share with you. That's all that I wanted to tell you, and thank you for your attention.